Have you got a lot of questions about how to prepare for birth? And are you wondering what you can do physically to prepare for a smooth labour and birth experience? My name is Beau, I'm an endorsed midwife, and today I'd like to talk to you about preparing for birth. I just want to emphasise how important it is to understand that preparing for birth is so much an emotional experience as well as a physical experience. So what can you do to prepare emotionally for the birth of your baby? Well, it's really important to maintain a really calm and grounded emotional well-being. And the way you can do that is through engaging with prenatal yoga, meditation, if that's something that you have done in the past or would like to try. Mindfulness and becoming aware of the present moment, because all of these tools will really help you throughout your labour to stay in the moment and to manage the pain of labour and the different sort of ebbs and flows of labour that it can take you on. And as a midwife, I speak to a lot of women on a daily basis about how they're feeling in pregnancy, and it is my role to really connect with women and see how they're feeling and if there's any heightened stress or other things that are on their mind leading up to labour and birth. Because if you do have stress, something in your life, financial stress, relationship stress, or even just fears leading up to labour and birth, which I can assure you many women do, it's really important to work through those things so that we can reduce your stress through pregnancy and ultimately in preparation for labour and birth. As a midwife, I've worked with hundreds of women throughout labour and birth, and oftentimes if they have emotional stress or fears coming into their birth experience, it can often influence the way that their labour progresses. So of course, we really want to support you in the lead up to birth to help reduce any stress and work through any fears you have. And there's lots of ways we can do that. If you feel like there's something really playing on your mind, you have symptoms of anxiety or antenatal depression, I'd really encourage you to reach out to your care provider and ask for some more support in terms of counselling or psychology in the lead up to labour and birth, so that those things can be managed before birth. In terms of your physical preparation for labour, I always encourage women, if it's appropriate for them, to walk most days of the week. And walking is a really good thing, both for the emotional well-being, but also for the strength and stamina in preparing for labour and birth. It also is a really, really good tool to get your baby into a really good position for labour and birth, because anything that we're doing, especially in those last 6 to 8 weeks of pregnancy, where we're upright and forward, will help to descend baby into the pelvic space in preparation for birth. So who are the other professionals who might be able to support you on a physical level in the lead up to your labour and birth? Well, a women's health physiotherapist will be a really great support for you, especially if you're experiencing any symptoms of pelvic floor dysfunction. For example, any urinary incontinence or heaviness in the pelvic floor. That would be really important to reach out to a women's health physio before birth to help to enable you to prepare for labour and birth and to reduce any symptoms leading into the postnatal period. Some other really wonderful professionals that might be able to help you on a physical level is an acupuncturist. They can offer you really holistic support in terms of physical symptoms like leg cramps, headaches, edema. They're really common symptoms, especially in the later stages of pregnancy, that often can be alleviated by some supportive acupuncture. Another health professional you might like to visit is an osteopath or a chiropractor, and specifically ones who have experience with working with women in pregnancy. I'd really encourage, if you have any pain in those last few weeks of pregnancy, if you have back pain, sciatica, really do consider seeing one of these professionals so that they can offer you supportive measures to reduce the pain and get you feeling in a really balanced and great physical state for your labour and birth journey. One other great support would be a pregnancy massage therapist. I really encourage women to really look after themselves, especially in those last few weeks of before meeting your baby. I think we are all in a bit of a rat race where we're not really sitting down and connecting with ourselves and our babies. We're in a rush to prepare for once baby arrives, and we neglect to connect with how we are feeling and how our body is feeling physically in those last few weeks of pregnancy. So a massage therapist will be really great support, and they can help you to feel a little less stressed and feeling physically strong and relaxed for your labour and birth experience. My final tip for preparing for labour and birth is to ensure you connect with a really good labour and birth education program. So whether you attend at your local hospital or have a look into Google to see birth education programs, there are lots of really great evidence-based programs that can support you and your partner to be feeling prepared both emotionally and physically for your labour and birth experience. So really do reach out and enjoy one of those programs leading up to the birth of your baby so that you can feel prepared and feel confident journeying into that labour and birth experience. I'd love you to join me on my next video where we'll talk about the benefits of having an active birth. So please subscribe to our channel below, and if you'd like to know more about our clinic, please visit athenawomensclinic.com.au. See you next time.